Ladies and gentlemen, welcome to Radivision, the new home of entrepreneurship, and another episode of Stories Live. Today we have our guest, Yuri Betish, founder and CEO of Datos Health. Yuri, welcome. I think you're in Greece, so welcome from the other side of the planet. Thank you for joining us.
Thank you, Nima, and thank you for having me. Pleasure.
Of course. By the way, why are you in Greece? That's not where.
Oh, there is there is a lockdown in Israel, and we thought about that the best the best way to spend the time during the lockdown because of the COVID would be in Greece, and we actually the entire family here, so it's
great.
Fun and work together.
A workation, that's what it is.
Workation, exactly.
Yeah. Yuri, tell us a little bit about yourself, your background, and then we'll dive into some questions that we have about what you're working on and specifically how it relates to COVID. Obviously, you're one of our nominated COVIDpreneurs, so we want to hear about what do you got cooking.
So by profession, I'm a industrial engineer specialized in operational research in optimization methods. And I started my career developing optimization methods for the brewery industry. And then from there, I moved to the retail industry, leading price optimization and inventory optimization. And I continue with the retail vertical for about 8 or 9 years. And then I left the retail, started Datos. But I took a lot of the retail know-how with me. And basically, the main thing that I took from retail is the marketing automation concept. And the main idea was that the healthcare industry actually is missing that piece of link about how to manage and create consumer journeys or patient journeys, if you will, in the same manner that the retail industry does.
That's interesting, but just so we understand, so you have an engineering background, you are in the brewing industry, and then you work on retail. What does that look like? That moment where you're like, okay, I'm going to do something in the healthcare space. When was that aha moment for you?
So actually, it was from both directions. The first direction was that the retail company that I was working at, I was the VP of product development, actually got acquired. And a year after the acquisition, many of us actually left the company. So that was a good opportunity. The other direction is that I always wanted to do something a little bit meaningful, and to use my experience and my know-how to the better good. And unfortunately, my father-in-law he's a CHF, congestive heart failure patient. In one of our Friday dinners, he had to be rushed to the hospital. And then I just couldn't understand why no one has this information that his situation is being deteriorated. And when I started to dig into that, I realized that in retail, we know everything about the consumer. We know what websites you've been, where you clicked, and all the information is flowing. And in healthcare, especially in 2015, it was far from that. And then I realized that this is exactly what I wanted to know. Take my retail background and to bring it to healthcare. The marketing automation is just a tool, but the idea is how to move data from your home into the healthcare institutions. There are many of them, but the idea is, if that's okay, I'm going to dig a little bit deeper in that. The idea is that a blood pressure, a glucose measurement, or any type of measurements that you're doing at your own home cannot make itself as it is into the EMR, into your medical record. There has to be some kind of process, but if we will have time, I will go into that. And this is where the company started to make that process much more efficient and basically to democratize the healthcare and not just to, the remote care was all along. I didn't invent remote care, but it was only for the acute patients. And my goal was to democratize that to all other patients and to open the basically the ability for everybody to be monitored at their own home.
Yeah, it's interesting to think that, in retail, you have this faucet of data that people are utilizing to shove more sweaters down your throat. And on the other hand, you've got this completely fragmented medical system that is super inefficient. And there's these walls in between the different segments. And you're not the first one to obviously talk about this, but that's really interesting. And so, like, I really love when someone talks about they had this unfortunate, family situation that was kind of the moment for them. But, how does one, in your case, get started? Like, what was kind of the first, what was the first 4 a.m. moment for you where you're like, okay, I've got to do this? Or like, how did you get started?
Actually, again, I was fortunate enough that I had some relations with some of the health institutes in Israel, and I started to run that idea about how you actually taking. I started with blood pressure. How you taking blood pressure and move it back to your medical record, and then I understood that it's if you have a call center, then that call center has to monitor the blood pressure readings. And every time that you have some kind of anomaly or high blood pressure readings, that call center would pick up the phone and actually call you. And that was the aha moment. I need to solve that missing link. That call center has to be removed,
right?
And we need to replace that with automation,
right?
And today, Datos is the remote care automation platform,
right? And so, is it really about, machine learning and understanding patterns that are causing triggers of other issues? Is that kind of, if we want to summarize it, understanding that and automating that?
So that's where we started. We basically built three data engines. One for data cleansing. So if we look at all your measurements at home to understand how to cleanse it based on the protocol. The second one was data tagging to provide the context, meaning that measurement was with medication or without medication. Was it before lunch, that glucose reading, or after lunch? And then the third one was data validation. Did you rest before that blood pressure readings or not? And I can take a look at your Apple Watch or your Garmin watch and make sure that you actually rested. So to mimic that entire settings, that when you're going into the clinic and the nurse actually takes your blood pressure, looks very simple, but that nurse actually makes sure that you rested, that you put your right arm on the table, and make sure that she's going to ask you the right questions. And if there's going to be an anomaly, she's going to take another reading. But at the end of the day, to your medical record, there's only going to be one reading that's going to enter into your medical record. So we took that entire process and we automated this.
Right.
That was the first thing that we did. The second thing that we did is that after a year or so, we understood that, okay, this is objective data, your devices data that comes from devices. What about the subjective data? Surveys, how did you feel today? How difficult was it for you to climb up the stairs? And things like that. And then we started to paint a full picture of your health. And then we started to put a really complex automation processes. And the idea was that every clinic within the hospital or with any health organization can design and deploy their exact workflow, both for the patients and for the providers, for the clinicians. And only when you're doing both of them at the same time, you actually create a seamless experience between the two parties, the patients and the clinicians. And I see a lot of startups today that only do one of that, one of the sides, like only take care of the clinician sides or only take care of the patient sides. In healthcare, you cannot do that. It has to be both sides of the equations, and it also has to be. It also has to provide better care in a lower cost. So it's like actually four pillars, if you will: clinicians, patients, cost, better care.
Right. I mean, look, I would argue if you call it the chicken and egg, the value proposition is different, obviously, right? So on the healthcare side, you want to create efficiencies and optimize the process, and obviously, I would hope savings. But for the patient, it's about checking in with them and having them feel safer, right? Like you're creating a perceived safety net in a sense by being able to aggregate and crowdsource this data. I want to understand. So technically, you're product agnostic, right? So it doesn't matter where the information is coming from.
Yeah, we can integrate to any device out there. We can design any survey or chatbot to get your data. It all depends from the condition, from the department within the hospital. But let me give you an example. Oncology symptom management. So this is a specific area where we have a lot of programs running, and in that area there are certain attributes. For example, oncology is not a situation with it being taken care of by your primary physician, and in that sense, hospitals and also oncology is a chronic condition right now. The life expectancy of oncology patients is getting longer and longer. So, in one hand, hospitals would like to keep the patients in their court. On the other hand, hospitals doesn't have the means to manage so many patients, and oncology patients are not being hospitalized. So there has to be a better way to manage all those oncology patients by their symptoms. And by the way, in oncology, it's not only important to remember to take your drugs, it's also important to understand when to stop taking your drugs because of the side effects.
Of course.
So that oncology program has a lot of attributes that relevance for oncology. When you move to cardio, for example, it's a whole different story, a whole different devices which you have to take care. And also the outpatient clinics in the hospitals are completely different. The idea was, who am I solving the problem for? And it is correct that I need to have a very good patient engagement, and I need to have a very good clinician engagement, not less important than the patients. But who has the check? Who am I solving the problem for? Right. And this is the CIO or the CMIO. That person that every department within the hospital basically knock on their door and say, hey, I have a widget and I would like to integrate that into the EMR. And another department comes and say the same thing.
Right.
The vision was that CIO or CMIO, they will have a budget line in a couple of years to horizontal platform that manage all the incoming data from the remote care.
Right. And so, you're building something, you're innovating a piece of this inefficiency. Early on, how were these conversations going? When you were getting started, what were people's responses as far as being able to pull this off? Because I would imagine that, again, because of all the fragmentation and all the disconnection, I know early on in electronic medical records that was the issue, and it still is, right? So how did you not give up or overcome those doubts and the people saying that this is not possible?
It was not easy, to be honest, and it's like dating. If you would like to have a date, you have to be ready to get a lot of no's along the way until you're getting that one yes.
Yeah.
But going back to healthcare is not one size fits all. Right. And today, it was quite obvious when I'm dealing with sophisticated systems, like for example Mount Sinai, and other systems also in Israel. Israel is quite advanced from a healthcare IT perspective, that they got it. On the other side, we had a lot of experience with unsophisticated systems that we tried to do pilots and programs over there, and we failed. And right. The idea is that you have to believe in yourself and what you do, because there's all the time, every day, there are pluses and minuses, there are wins and losses. And the wins are fine, but in my mind, we have to learn about why have we lost.
Right,
and those are the key things that every time we're getting more and more. We learn more and more from our failures and trying to improve the future. I would say that I had one aha moment in that journey.
Cool.
I remember that we opened the company and we had one very sophisticated customer in Israel, and I was I couldn't convey the message that much to it was difficult for me to convey the message to other health systems until I met Mount Sinai from New York. And I was, coming to that meeting, and I was under the impression that, they're probably going to kick me out of the door after 5 minutes. And the entire meeting that we had was set for 15 minutes. At the end of the day, we spent over an hour, and they said, this is exactly what we are looking for. And we are trying to integrate data from devices into the EMR, and we all the time failing. And this is exactly that layer that we need in between the EMR and the devices. And that was the aha moment. And I remember that after that, this meeting, I was so excited because I understood that I do have something in my hand that nobody else has at the moment. And I'm actually ahead of the curve in about 2 or 3 years. So if I'm going to build a robust product and platform, I do have a sustainable business model.
So at that point, had you built an MVP or a prototype, or were you just, what stage of product development were you when you had this conversation with Mount Sinai?
We had an MVP. It was already in production, very limited, mainly around hypertension and diabetes. Mm-hmm. And but it was not scaled. Let me put it this way. My investors thought that I still don't have a product market fit, and they were right, of course. And today, of course, the product is in the product market fit is mature, and we know how to address that exact budget line in health systems that not all of them has. By the way, it's still going. If you look at EMRs, if you remember. Right, EMR started from 08, 09, and we're still right now at the end of the transition to a full EMR. So it's going to take time in healthcare. And if you don't have patients, this is not the place to be.
And so you said you started 2015, right? So this is all pre-COVID, right? So you're going along, you're getting validation from these institutions, you're onboarding clients, and then tell us what happened. January or February of this year.
It was crazy, but one sentence before that, the entire value prop of the platform, it's the ability to design in a drag and drop, no code environment, remote care programs.
Yes.
So February this year, during actually a call that I had with one of our clients in Israel, I got a phone call. The lady on the other side told me, Uri, I'm asking everybody on the call, please drop, and I need to speak with you alone. And she told me that the Ministry of Health actually selected them to be the primary hospital to treat COVID in Israel. Mm-hmm. And they would like to use our system for both inpatients and outpatients COVID monitoring. And I said, okay, that's great. Next, one thing led to the other, and I found I actually, after 2 weeks, I had a military unit in my company helping me advance integrations. Military unit for computer engineers, helping me to advance integrations into the health systems in Israel to support all the COVID patients, to monitor all COVID patients at home. And it was crazy. All of us went, we were working from home. We actually had another unit, a military unit in the company, which was crazy. And we worked around the clock.
How big was
Sorry?
How big was your team at that point?
We were 25 people in-house, full-time employees, and another 8 people from that unit.
Wow.
And yeah, and it was really hectic. The good thing about it, that most of the work was on integrations to the EMRs and all of that. The ability to design that COVID program, it's actually 10 minutes in our platform. So it's not that we did a pivot, or the platform
Right.
was designed to support new programs all the time. After the Ministry of Health actually contracted us in Israel, then we started also to deploy our remote COVID monitoring around the globe, in Italy, for example, in Milan, and also in the States, where we work both with health systems, but also with the county health departments in several counties, and we deploy that. And we have one case study, I think it's actually was published, where we actually took a health system, and in one day they actually were live with monitoring COVID patients, and automating that exact that whole process of monitoring COVID patients at their own home.
Wow, that's really cool. And then in the middle of all this, you were also fundraising, right? I mean, you're always fundraising, but I saw that you closed the round. Did that actually help? I mean,
absolutely. You know, sometimes you're saying to yourself, "Wow, the stars aligned."
right.
So something bad has to happen. If all that good things happen, something bad. Next thing probably going to be something bad. So yes, we actually closed the round prior to the COVID, and we were hiring like crazy. Everybody's laying off around us, and we are hiring.
Right.
And it was a really good. It's actually saved us. If we couldn't close the round prior, not sure if it would be the same without.
And so tell us a little bit as far as like the momentum you've gained since then, and so what are you working on now? What's next? Talk a little bit about kind of the product.
Yeah. It was quite a ride since the COVID, and to be honest, it's still not over, as you probably can imagine. And I think one thing that I learned from the COVID is to be humble, and to really not trying to foresee the future. In the beginning of the COVID, we thought that this is our jackpot. We actually hit the jackpot. But then we realized that people are not going to hospitals that much. And hospitals are actually earning money from people coming to the hospitals, right? So actually, all the IT budgets of the hospitals are going down.
Oh, wow.
And this is something that we didn't expected. And again, we didn't do any pivot, but it's still the same platform, the same product. But now, instead of designing only hospitals' remote programs, we are now moving to what we call back to norm. So a lot of employers, a lot of payers, they need to cope with the new era of the COVID. And the idea of how to design the monitoring of employees by employers, and to work with companies like Kaiser and Anthem, and to provide them the ability to basically rapidly deploy that new program. But now it's not from the clinical perspective. Now it's more from the back to norm perspective, to make sure that you don't have any symptoms and you are clear to go back to work. And this is the new segments that we actually realized because of the COVID.
So is that then, in a sense, more consumer facing?
I wouldn't call it patients. Those are not patients. We call them members. Before that, we haven't dealt with employers, with payers that much, and now that's probably the majority of what we do today. And you can call it consumers, yeah.
And so, what do you think is going to happen with COVID, and where do you see this whole thing going from your perspective, and what are your thoughts on that?
The $1 million question. I think
more like I actually did the math the other day. It's a multiple $1 trillion question, actually.
Again, to be honest, we have to be very careful and very humble about how we foresee the future. If you look at the telemedicine virtual visits trends since the COVID, you would see a trend, a spike in April, and then in May and June it's actually going down.
Right. I mean, look. Yeah, I was going to say, change that behavior, right? As far as human behavior, a lot of people, I talk to them, and we've done a lot of these interviews, they just feel like they're getting an inferior product if they're not going into the office. And so changing that behavior, I think, unfortunately, it's going to take more than just, the pandemic, and it's going to take some time. But I would ultimately, I would argue that from both sides, it's just inefficient, right? Like, you're going to the office, most people's symptoms aren't really serious, and so it's just bogging down the system. It's increasing the cost, and then at the end of the day, you still have to drive there and back. So, but I would say it's still going to take some time to genuinely change user behavior for people to say, have trust in the fact that this is basically the same thing as going into the office. So I think it's still going to take some time, but I can tell you, having done something like 27 Zoom calls last week, that for people in the tech world, that behavior change is already there. So I guess
again, I think it's not that like the way that I'm looking at that is it's very complex, and the dynamics in healthcare is not that simple that you can say one way or the other. So a couple of points. In the first wave of COVID, over March and April, those people that we monitored, they didn't have any other choice. Like, right. It's not like today that you have the ability to opt in to a video consultations with your physicians, or you can go face to face.
Right.
Back then, it was, and we had to support all of them. So we have developed the IVR options, meaning to communicate with the elderly with a phone interactions and things like that. And the way that I'm looking at the future is that, from a healthcare perspective, a digital health perspective, definitely we got a tailwind, and a strong one. But it's not that all of our problems are now solved, and everything that we can do remotely is going to be done remotely. So it's going to be a hybrid mode. And I think also it's not going to go back to the same way that we've been before. There are certain areas that still going to, even that they can be done remotely in healthcare, still going to be done face to face. But the tailwind here is here to stay. And we are not over yet. So there's going to be, I think there's going to be a lot of surprises down the road.
Yes, I agree. It's always surprises. Where do you see Datos going as far as, taking on these surprises?
I think that from a data perspective, we would like to be, a lot of COVID patients actually came through our platform, and to have the ability to do something with the data, understanding how patients on a large scale actually handling or coping with the disease, and it's something that you don't have. Like, most of the COVID data that you have today is from the hospitals. How much time on average is going to take for a patient to go from light symptoms to severe symptoms, or things in that nature, that I think that we have a lot to contribute around the COVID are ahead of us, and this is where we're going to put our focus and emphasis in the future. And again, be humble, be patient. It's not over yet. Nobody knows how it's going to be developed. So we are ready, and it's really important to be agile with how you foresee the future.
Yes, you're absolutely right. We have a bunch of questions from the audience. So if you want to jump in, I'm going to start highlighting them. So this is a good one. What challenges do you face as an entrepreneur that you should be aware of? Like when you were getting started early, like what mistakes do you think you made, or what would you have done differently?
I've done a lot of mistakes. And let me tell you something. The difference between the first timer and the second timer is huge. I think that if I'm going to open the second startup, I'm going to do so much less mistakes. I'm still probably going to do a lot of mistakes, but I think that the main challenge is the tension. If you don't have that elephant skin and to cope with the tension that you have to pay salaries at the end of the month every month, and you have to raise money all the time. It's those were the first challenges as an entrepreneur, and you have to. It's important to remember that every entrepreneur, every time that you open a startup, you're doing something that nobody else actually believes in. If people had believed in it, it wouldn't be a startup. So you have to convince a lot of people, and you have to stick with your beliefs, and it's not easy. And you have to accept it that majority of the startups are actually going to be closed in a year or two. Right. So I am fortunate enough that I had my background before I opened that startup, and I took that retail experience with me and bringing something that is really unique. Stay cool.
From that question, I want to ask you, what's your favorite part and your least favorite part of being a founder?
I think that actually the favorite is easy. Every time that I'm getting a feedback from patients or from physicians, it's like I'm going back home from the office with a smile on my face. I'm lucky when I have ears to stop, to hold my smile together. Yeah. The most difficult or boring or challenging part is for me. I'm more of a visionary. I'm less of a process guy. Right. Everything regard finance and planning and process, I'm not that strong, and I think that, but again, if you think about opening a startup and if you think about entrepreneurships, you have to understand and realize what your strength and where you need help, and it's really important that you realize that as early as possible.
Yes, and then delegate and motivate.
Exactly. Yep.
Okay, next question. Maybe we didn't cover this enough, but can you give us just a little bit more technical summary of how the platform actually integrates with the devices?
Okay, so this is actually a little bit, it's not that technical, but it's a little bit more detailed. We realized that there are a lot of devices out there. And there are also a lot of different manners of integrating devices. Let me give you some examples. I have a Garmin watch. The integration goes through the cloud. I have an Apple Watch. The integration goes through the mobile app. I have a blood pressure cuff, and that's a real-time monitoring, meaning that every time that I have a blood pressure readings, I need to real-time upload that data to the cloud. And I have, in some other instances, that the same blood pressure cuff can be stored and forward, meaning asynchronous. So the ability to create an infrastructure that can support both mobile-level integrations and cloud-level integrations, both real-time integrations and store and forward integrations. But most important, by the way that I'm looking at it, if you think about device integrations, this is the easy part. It's technology. Everybody can do that. The tough part is, what am I doing with the data? I got a high blood pressure readings. Am I contacting that patient automatically and asking them what? Did you take your meds in the morning? Or can you answer that short surveys? that patient, this is the patient experience that we need to focus on, and not just about the technicalities about how to integrate that device. I hope that makes sense.
Of course, definitely. Next question. This is interesting. So how cost effective is the solution compared to other alternatives? So when you've identified that budget line, how many other people are you competing with RFPs and this process?
So of course, we have competitors, and if you don't have competitors, it means that you don't have a product market fit. I think that I cannot talk about other competitors to that specific question. What I can talk about the Datos platform, and we have studies that shows that we have a multiplier of 5 times the clinicians' utilizations versus the traditional care processes.
That's awesome.
We also have the ability. Usually, what we do is that we introduce a remote care to existing care processes and create hybrid approach, but we're not entering. We're not having more resources or more clinicians to support our new patients, new remote patients. So under the same staff utilizations, and this is actually across the board in all our programs, under the same staff utilizations, you can actually do more patients, again, because we use a lot of automations,
right,
for those processes.
Awesome. A couple more questions. You have a recent partnership with Vika Medical. Someone was asking about that. Can you share a little bit about that?
Absolutely. Vika is a great company, and more importantly, great people. I really appreciate them. And so from a technology perspective, we've integrated with them, and that's actually a medication dispenser that provide us the data for when you took the drug, and what were your compliance. We actually started the partnerships with in a program that was psychiatry home hospitalizations. And again, every time that I'm learning new stuff about new programs, but I never thought that was going to be relevant for our platform. So if you think about it, a person comes to the hospital, so to the ER with stress and has to be hospitalized in the psychiatry department. Instead of going to the psychiatry department, we actually give them a bag with a tablet and devices, and with the Vika solution, to be hospitalized at their own home, monitoring, and this time it's a real-time 24/7 monitoring because it's home hospitalizations. It's the same process as inpatient as we're doing in an outpatient.
Wow, that's pretty valuable and cost-effective. Let me see. I think we have one more. Someone asked about what are the key remarks of Datos coronavirus telemedicine program test in Israel? I'm sure.
What do you mean by remarks? I'm sorry that I'm not following.
I'm not sure. Maybe they're talking about how you tested this in Israel. I think we talked about this already anyway. Yuri, I think that's it for questions. Was there anything final that you wanted to share with our audience, or any departing thoughts about this shift in humanity that we're experiencing right now?
If you have an idea around healthcare, and this is, in my opinion, this is crucial for all entrepreneurs out there. If you have an idea around healthcare, you always have to remember those 4 pillars: patient, clinicians, cost, I forgot now. I'm sorry. I'm being a little bit the processes. So take a look at the entire equation of what you're trying to solve, not just the specific. And if I have time, I just would like to make one remark. I do know a lot of companies, a lot of startups that came with a brilliant solution, and one of them actually already have like a Harvard Business review of that solution that's going to save more than 150,000 lives in the United States, but we cannot implement that solution, not because this solution is not good, because we didn't take care of the process around the clinicians. So think about all the angles.
Right.
It cannot be just one of them.
Right. No, you're absolutely right. And I think a lot of people have these visions or these, they think build it and they will come, but you have to figure out, in your case, again, how is the clinician going to interact with it? And I think ultimately for you, this, let's call it the customer journey or this implementation journey is what you're really optimizing and solving and making more efficient, better. And I'm assuming you're taking product development, UI, UX stuff, to make this more pleasant, right? And so that I think ultimately is also more important than just thinking of cost savings and kind of thinking of it as like business wise, because at the end of the day, someone has to still interact with it, use it, like it, enjoy it, and then tell other people about it. So Uri, I want to again congratulate you on the work that you're doing. I always say that it's really refreshing to hear someone not working on a video sharing app or something in advertising. So, again, I want to congratulate you and thank you for the hard work. Keep it up. Keep us updated, and I wish you all the best and good luck and enjoy the rest of your workation. I hope everybody's safe, and we will check in with you soon. Thank you so much
for having me.
Of course.
Bye-bye.
Thank you so much, ladies and gentlemen. We'll see you next time. Have a great day.
Bye-bye.